This is a CBS News special report.
Kantien is here.
The 1960s saw a tremendous change and social upheaval in our country. The Vietnam War was ravaging abroad, and back home profound change was also underway. The invasion of the Beatles and their music transformed a new generation. Amidst civil strife, demonstrations, and the introduction of a new culture, George and Honey Buckley stood their ground, and they brought healing, human kindness, treating each person, each individual, that they helped with the respect and the dignity that is the birthright of every human being. Buckley House became part of the fabric of our lives right here in Eugene, Oregon. In the early 1970s, Buckley House was designated as the official emergency detoxification center. The response that had been started a decade before became official, and Buckley House was officially right there to help.
Today, the Buckley Center Detox is a community resource that has enhanced services available. A full continuum of care is available to the individuals who come here for help. It is the gateway for many of these folks into treatment. In the past 12 months, we have served 1,400 individuals.
In the 1980s, when Steven Spielberg brought to the big screen the possibility of interterrestrial friendship, Buckley House secured licensure for 2 residential treatment programs, Carlton Center for Men and Sunrise House for Women.
The residential treatment is a structured living environment where an individual will come and stay anywhere from 60 to 90 days while they learn about the disease of addiction. We help them recognize how their disease has impacted their life.
In the 1990s, longtime political prisoner Nelson Mandela was freed from his imprisonment and later went on to become the very first Black African president of South Africa. At the same time, Buckley House needed to expand to meet the growing needs in our community and became Willamette Family Treatment Center. Later on, the Men's Treatment Center was relocated to our current site on Green Acres Road.
Our men's residential treatment program, also known as the Carlton House, is a 24-hour high-intensity service that offers a host of behavioral health interventions not otherwise available in lower levels of care. Over 30 years ago, Willamette Family recognized that a person's gender had the potential to affect several critical points in regards to behavioral health symptoms and their consequences. The opening of the Carlton House addressed these diverse needs in a gender-responsive environment.
As the new millennium began, there were fears about the computer glitches and what that would mean for our way of life. Despite that, Willamette Family kept its focus on the future and the growing needs of our community. In 2003, we purchased our Cheshire and Green Acres residential centers. In 2006, we obtained our mental health license, and in 2007, our downtown outpatient clinic was opened. The following year, we expanded our women's outpatient treatment, added DUII services, and opened a clinic in South Lane County.
Outpatient treatment is a lesser intensity form of treatment where individuals don't actually reside at a treatment center. They continue to live in their own homes wherever they resided, and they come in for group sessions anywhere between 1 to 3 times per week, as well as individual sessions.
The Family Services Program provides services to parents participating in any one of our treatment services, and the focus of the program is to respond to their needs. The On-Site Child Development Center provides care to the children whose families are participating in any array of services within our treatment programs.
In this second decade of the new millennium, we opened our first medical clinic, funded by a United Way grant.
In 2014, Willamette Family applied for and received an innovative grant from Trillium Healthcare so that individuals on the Oregon Health Plan can receive integrated primary medical care within a behavioral health setting. This is the foundation of our medical clinic, which officially opens today. Us having the clinic here has been very invaluable. Not only have we been able to see patients quickly and timely, we're providing patient-centered care that incorporates everything that a person might need. So the cost of care for patients is really individualized. If a person is 200% below the federal poverty level and they have not applied for any type of insurance, our goal is to treat them quickly. So we bring them in, we still receive money from the United Way to provide services temporarily to those individuals who have no funds. So they don't have to pay for the care that they're getting here at the clinic.
Willamette Family's Peer Support Services were the first state-certified program in Oregon. Peer support extends the clinical reach of treatment and supports each individual's journey to health and sustained recovery. And today we are announcing the official opening of our Rapid Access Center, which streamlines access to services for those we serve.
The idea behind the Rapid Access Center is that when people are reaching out for help, that window of motivation is open right then and there. At the same time, Willamette Family recognizes that oftentimes that window of motivation stays open for a very brief amount of time, and that when that person reaches out for help, we need to be there, willing and ready to accept them and bring them in.
At Willamette Family, our diverse array of health services provides an expansive revenue stream. Combining our program services with prudent business analysis allows for strong financial sustainability.
We've been here for 50 years, and our plan is to be here another 50 more.
Willamette Family has not wavered from our mission to provide health, wellness, and recovery services in each and every one of our programs. But over the years, our delivery sure has evolved to respond to the changing needs of families in our community. Our continuous review process, our motivation to seek out new and promising practices, and our work with research organizations has allowed us to develop, validate, and refine new strategies, most of which are used in our treatment programs today. There is no wrong door, and individuals and families access our programs from many different directions.
50 years ago, one couple's compassion and belief in the human spirit started this amazing agency that has helped thousands of individuals and their families begin and sustain a life of recovery, hope, and fulfillment. At our core is the profound and unwavering belief that inspired George and Honey Buckley to open their doors and offer a hand to that very first individual whom they welcomed into their home. Today we are officially opening our Rapid Access Center and the Medical Clinic to once again respond to the needs of our community in the same way that the Buckleys did over 50 years ago. Thank you for being part of this celebration and official opening of these critically needed services for our community.